Good afternoon and welcome to Thoughtful Thursday, where we continue to explore the positive developments shaping primary care across the United Kingdom. Today's episode focuses on one of the most significant and encouraging trends currently transforming general practice: the expanding role of community pharmacy in improving patient access to healthcare. Over recent months, there has been a growing national focus on enabling community pharmacies to provide a broader range of NHS services. With continued investment and the rollout of independent prescribing for qualified pharmacists, more patients are now able to access assessment, treatment and advice closer to home, without always needing a GP appointment. This represents a major step forward in delivering faster, more convenient care, while supporting general practice to focus on patients with more complex clinical needs. The impact is already being felt across primary care. Patients are increasingly recognizing their local pharmacy as an accessible healthcare destination rather than simply a place to collect prescriptions. From managing minor illnesses to providing advice on long-term conditions and medicines optimization, pharmacists are playing an even greater role in supporting communities. For patients, the benefits are substantial. Access to expert clinical advice is often quicker and more convenient, allowing concerns to be addressed promptly. Many people appreciate being able to receive assessment and, where appropriate, treatment from a highly trained healthcare professional without waiting for a GP appointment. This not only improves convenience, but also helps patients receive the right care in the right place. GP practices are also seeing positive outcomes. By enabling pharmacists to manage a wider range of appropriate conditions, practices are able to dedicate more clinical capacity to patients with complex illnesses, multiple long-term conditions, and urgent medical needs. This collaborative approach supports safer, more efficient care while helping reduce unnecessary pressure on already busy surgeries. One of the most encouraging aspects of this development is the strengthening of multidisciplinary working. General practice, community pharmacy, nursing teams, and wider healthcare professionals are working more closely together than ever before. Information is shared more effectively, referral pathways continue to improve, and patients benefit from a healthcare system that feels increasingly connected. This reflects the wider direction of travel for the NHS, with care moving closer to patients' homes and greater emphasis being placed on prevention, accessibility, and integrated neighborhood services. Primary care continues to evolve by making the very best use of the skills available across the healthcare workforce, ensuring patients receive timely, safe and high-quality care. Importantly, this trend demonstrates that innovation within primary care is not always about introducing entirely new services. Sometimes, it is about empowering existing healthcare professionals to work to the full extent of their expertise. Community pharmacists have long been trusted healthcare providers, and their expanding clinical role is helping create a more resilient, responsive, and sustainable NHS for the future. At General Practice Solutions, we are proud to support GP practices as primary care continues to evolve. Through workforce support, operational excellence, and streamlined administrative services, we help practices create the capacity needed to embrace innovation while continuing to deliver exceptional patient care. Thank you for joining us for this week's Thoughtful Thursday. We look forward to sharing another positive story from primary care with you next week.